The attended appointments with no treatment report is an audit report listing appointments in titanium where the client has been marked as having attended. However, no valid treatment has been entered for the client that is dated the same date as the appointment. This provides a prompt for following up such client attendances, as treatment performed may not have been entered by the clinician in titanium, and that has revenue implications for your agency. A common occurrence is that treatment has been entered by the clinician, but wrongly dated. Often, the date of the treatment is the day after the appointment, as the clinician has entered it in titanium the day after, but has not backdated the treatment to the previous date when the client was actually seen. Although the treatment's not missing, this anomaly should still be corrected so that the clinical history accurately reflects when the treatment was actually provided to the client. The attended appointments with no treatment report is accessible under the Appointments Reports group of the Titanium Reports menu as shown here. The available filters for running the attended appointments with no treatment report include your agency's password code, which need to be entered in the agency code field as described in the report's overview video. And the only other filter is a simple start and end date, where the report generated will provide a list of appointments with no valid treatment where the client has been scheduled within the date range entered. A sample of the attended appointments with no treatment report is displayed here. Each row of the report represents an individual appointment record. The ideal situation is to produce a blank report, which indicates that there are no attended appointments with missing treatment. Those that do appear on the report need to be actioned. The detail provided for each appointment record includes the client's titanium dental record number, the appointment date and time, the room or surgery name, and the clinic that room is assigned to, the provider code of the appointment record, and the status of the appointment, which will be arrived, seated, or completed. Appointments with a book status will not be in this report, as they represent appointments where the client has not attended. Note, the attended appointments with no treatment report excludes appointments marked as private. That is, it only includes public appointments linked to episodes. You should also be aware that the assessment of whether treatment is entered or not for clients that have attended is based on valid treatment entry only. You may find when examining the treatment history for some clients appearing on the report that there are treatments visible, but they will be invalid treatments, many of which are alphabetic codes such as GenNote. Where a client has attended for a visit, but no treatment was completed in that visit, the valid item code 799 should be entered. A common question in actioning the appointments appearing on the attended appointments with no treatment printout is, what if the course of care and episode is closed? How can I enter the missing treatments? Well, even though the course of care and episode is closed, you can still reopen the course of care by selecting it in the course of care tab and clicking on the Edit Course of Care button. The course of care will be returned to the Chart tab, where you can add treatments to any visit there. You can also add a missing visit, but the only restriction is that you cannot add a visit that is dated after the course of care closure date. If the missing treatments are after the course of care closure date, they will have to be added in a new course of care and under a new episode. Once you have added any treatments to a reopened course of care that is in edit mode, you can then simply close it in the normal manner through the Close Course of Care button in the Chart tab. The attended appointments with no treatment report is an important report to run on a regular basis. Missing treatments will impact revenue for your agency from both a funding and patient fee point of view.